यार कौन कॉल हेलो यार मैं बोलता हूँ तुम्हारे को मारो तुम it's dollar sign
blood flow problems such as stroke, aneurysm, tumor, etc. So please recite aloud salawat and we will welcome Dr. Kazim Narsin. Salawat. It will be nice if all of you move forward.
Assalamu alaikum, everyone. My name is Kazim Narsin. Thank you for giving me the chance to speak. I'm going to talk a little bit about stroke. We'll talk a little bit about diagnosis and prevention, and then finally how to treat it. And my message for you today is that you should care about stroke because it is the most common cause of disability in the world. Out of 5 people who have a stroke, 2 of them will not be able to live independently afterwards, and a 3rd person will be permanently disabled. That means not able to walk or talk. Next slide, next. About one of those 5 people will die within that year, and it has an occurrence of about 800,000 in the United States daily. So although it's a dire diagnosis, you can spot a stroke. Every one of you in this room can spot a stroke. The important thing is that you need to be fast, okay? So what does that mean? The F in FAST stands for face, so look out for facial drooping. So you ask your relative that you think might be having a stroke to smile, and if one half of their face is not moving, it's a facial droop and it's concerning. This guy has a facial droop, okay? All right, next one. The next thing you look for is the arm, okay? Ask them to hold up both of their arms. And if they can hold up both of their arms, then that's a good sign. But this guy cannot move his left arm. You ask him to lift up both his arms, and remember, the same guy whose face isn't moving, his left arm isn't moving either when you ask him to lift both arms. So you got the face, you got the arm. Everybody can do this, okay? Then next, you look for speech. This can be a little bit more challenging, but usually patients don't have adequate speech output, or what you're saying to them doesn't seem to be making sense. So a problem with speech going in or speech coming out. And then the last thing is time. If you see these 3 things, problems with face, arm, and speech, you need to call 911 right away, get the patient to the hospital, because time is of the essence. So we think about stroke in terms of not enough blood in the brain or too much blood in the brain. Ischemic stroke is not enough blood in the brain, so this could be due to a blockage in one of the blood vessels down in the neck, causing not enough blood flow up to the brain. Or you could have a hemorrhagic stroke, which is too much blood in the brain. These can often be due to aneurysms, which are little balloon-like outpouchings from the blood vessels that can bleed. So let's go back to, next slide. Let's go back to our guy here who can't move his arm and his face is all droopy. What's going on with him? So we had a patient like this who came into the hospital a couple of weeks ago. You take a look at their CT scan down in the ED, which shows that there's a clot in an area of the brain called the right middle cerebral artery. You guys can see that this part of the brain has like this bright line over here. And then based on this, we can, see it's highlighted. So clot in the right middle cerebral artery. And then if you look further down in the neck, there's a blood vessel down in the neck called the carotid artery that isn't filling with contrast. Next. So that's there on that, with that red circle. So then we bring the patient into the angiography suite and we put catheters into the neck from different access sites in the leg and in the wrist and thread them up into the blood vessels in the neck, open up the blood vessels up in the head. So now this blood is flowing up in the head. Next slide. But we have to deal with this problem down in the neck where the blockage came from. So that's what these slides are showing. And this patient actually made a pretty good recovery. Next slide, I'll show another. This is another example of like a narrowing down in the neck, which you can treat by putting wires and catheters past it and then stenting it, putting in these wire tunnels to normalize the blood flow. So this is an example of not enough blood flow causing a stroke. Next. So this is this, and then this is just another diagram which shows how you can treat the narrowing by putting in one of these stents. What are the risk factors for developing this? Some things you can control, some things you can't. These are things you can control about your risk of having a stroke. Don't smoke, be physically active, eat a good diet. There's other things that could contribute to causing a stroke that you can control with medicines. So high blood pressure, diabetes, heart arrhythmias, and problems with your high cholesterol. All of those things can be treated with medicine though. And then there's certain things you can't control. You have a family history, your genetics are bad. Some of the reasons for kidney disease you can't really control. But there's plenty of here that you can control in the orange and blue that we can focus on. So just one more example of a stroke of the different type. So this is a CT scan of a patient who came in with a severe headache and had double vision. There's a little bit of blood in this area of the brain called the Sylvian fissure. Forward one. You remember how I was saying there's a balloon that can bleed in the brain? So on the next slide, you can see that round circle there. That's an aneurysm that's responsible for the bleeding. And then we can use a variety of catheters and tools to block off that aneurysm from the inside so you don't see it anymore. And that's just to remind you guys what a diagrammatic depiction of an aneurysm is. These are a couple of more examples of aneurysms. You can see the balloon-like outpouching here from the blood vessel. Next slide. And then putting a variety of different materials in there to block it off from the inside so it doesn't bleed anymore. Before or after. One more, I think. We can skip these. Does anyone have any questions? So there's many reasons for having a blockage up in the brain. And one of the reasons for having a blockage up in the brain is a blockage in the neck. But there's other reasons like heart arrhythmias or other parts of the body, clots can flow off. But that's a common one, and just the example is of that. So the question was, why only the neck? And the answer is it's not only the neck that can cause a stroke up in the brain. It's the example I chose to show, but there are lots of other reasons for having a stroke from the heart and other places. That's a great question. So the question was, what is the time period that you have to react when you think that somebody's having a stroke? The short answer is you have 24 hours, okay? But the reason that the time is so important is because the longer you wait, the more likely the brain is to die and for there to be nothing to be able to be done. So the sooner the better. So if somebody has a stroke in the hospital and we treat them within 15 or 20 minutes, they can make a full recovery. If they have a stroke at home in the middle of the night and they show up the next day, there's very little brain that we can save. We can save a little bit, but most of the brain is already dead. So time is of the essence. If you see somebody with a facial droop, you see their arm dropping, and they're having problems with their speech, you need to call 911 and get them in right away because they could be having a major stroke. Other questions?
We will have a question and answer session after the second speaker. Thank you very much, Dr. Kazim. You know, you came here at a very short notice. I just called him in the afternoon, not even in the afternoon, in the evening, because our first speaker, Dr. Syed Amir Ali, cancelled. He could not make it tonight. So we had Dr. Kazim Narsi instead. Now let me introduce Dr. Ali Raza Khaki, who is quite familiar here. He spoke to us a few years ago also. He has been in and out of the Bay Area, and now he's come back to the Bay Area for good, isn't it? Inshallah. So Dr. Ali Raza is a hem-oncologist. That means he deals with blood and cancer patients. He's on faculty at Stanford Medical School and he works at Stanford Medical Center. So please, with a loud salawat, welcome Dr. Ali Raza Khaki.
Thank you, Mother Uncle. I'm going to sit down here so I can look at my own slide. And hopefully everyone can see me then. The slide's up yet? No. Okay. Bismillah ar-Rahman ar-Rahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. Assalamu alaikum, everyone. Thank you, Mother Uncle. Thank you to the Saba leadership for allowing me to speak today. Kazim is a stroke doctor, and you got to speak about stroke. I'm a cancer doctor, and I'm speaking about COVID. So I'm going to apologize in advance for not being an expert, but please have patience with me, inshallah. And I also wanted to remind you that I'm going to have maybe one or two more controversial slides in here. So this is a general talk. It's not specific health advice. If you have specific health questions, please talk to your own doctor. So here's the outline of my talk. We'll go through a brief history of COVID. Then we'll talk about the symptoms of COVID-19, risk factors for severe disease, the treatment breakthroughs we've had over the last 2 years, and then we'll talk about a look to the future and some closing reflections. So to start out, this is a timeline that we're probably all too familiar with, as it's been our last 2 years. In late 2019, there was a new pneumonia being caused in a specific region in China. Initially, there was just whispers about it. And on the December 31st of 2019, it was reported to the WHO in China. And about a week later, they identified that it was from a new virus called SARS-CoV-2, with the disease that it caused was called COVID-19. And 2 weeks after that, on January 20th, there was a first case in the United States. And that case was actually identified in Washington State, where I was residing at that time. And within 2 months, the whole world had shut down. That's what we've been living through for the last 2 years. So we go to the next slide. This is what our cases and deaths have looked like here in Santa Clara County, in our own backyard. So on the graph on your left is the cases over the last 2 years here in Santa Clara County. There's been over 314,000 people who've been diagnosed with COVID-19 during this time period. And over that same time period, here again in our backyard, we've lost over 2,000 lives of our brothers and sisters in humanity. And you'll see that at different times we've had different waves. So back initially, in March of 2020, you might remember we talked about flattening the curve. Well, we did flatten the curve, but then we kept beating the curve. And so we had the Alpha variant in late 2020 with the initial sort of big surge that led to a lot of death. We had a Delta variant that was much more suppressed, unfortunately, because of vaccines. And then most recently, the Omicron variant. If you go to the next slide, we see a similar pattern in California, now with over 8 million confirmed cases and 88,000 deaths. And the next slide, around the world, 500 million cases, 6 million people have died from this disease. And if you go to the next slide or next figure, you'll see that we in America always like to be number one. And fortunately, with COVID, we're also number one, or unfortunately, with 80 million cases, 985,000 deaths on this figure. But if you look at that list of the top 15 countries, it also includes India and Iran. So even if you're American or you've immigrated to this country, you have family back in the Middle East or somewhere in South Asia, this has clearly affected every one of us in some way or the other. So next, let's go to the next slide and talk next about symptoms of COVID-19. So this is a figure from the initial symptoms of the first patient, that patient in Washington State, in January of 2020. So this patient had traveled from China on January 15th, and a day after he reached the US, he developed a cough. A few days after that, he was in the hospital, and he had a fever in the hospital for about 6 days. He also had rhinorrhea or runny nose. He had fatigue, nausea, vomiting, diarrhea, and abdominal discomfort. These are some of the common symptoms people may have with COVID. If we go to the next slide, there's a longer list of symptoms of COVID-19. I think the most common symptoms, actually people in this room might have had COVID, and you could tell me better than I know myself what it feels like to have COVID. But the most common symptoms that people I've heard describe as being associated with COVID is fever, body aches or myalgias, fatigue, being tired, cough. There are other symptoms. Some people have sore throat, some people have diarrhea or abdominal symptoms. And then a unique symptom, especially early in the pandemic, was the loss of taste and smell, which has been less prevalent with the Omicron variant. But what's also notable, if you go to the next slide, is 40% of infections may be asymptomatic or minimally asymptomatic, which has made this so difficult to control as a virus in this pandemic. So then if we go to the next slide, we'll return to our outline and we'll talk about risk factors for severe disease. And on this figure, you'll see two tables again. This is cases on the left and deaths on the right. And this is stratified or broken down by age. And so what you'll see is while cases are widely distributed from the young to the old, most commonly in the people in their 20s, 30s, and 40s, deaths are very severely skewed to the older patients. For people in their 50s, 60s, 70s, and 80s, age is by far the greatest risk factor for severe disease and death. Okay? But there are other risk factors on the next slide, and that's a lot of comorbidities or other diseases that some people may have. And if we click through some of the ones I highlighted that might be relevant to our community, we have diabetes, heart conditions, obesity, and physical inactivity. These are all similar things to what Brother Kazim was speaking about with stroke. So the same things that put you at risk for stroke also can put you at risk for COVID-19. So a good reminder for us to watch what we eat here in Ramadan and make sure we continue to maintain activity. And then I also highlight smoking, but inshallah, none of us are smoking anymore. That's something that happened in our parents' and grandparents' age. And cancer, because this is near and dear to my heart. I treat mostly prostate, bladder, kidney, and testicle cancer at Stanford. Fortunately, for most solid tumors, while there is a slight increased risk of COVID, I think the most severe disease with COVID for cancer patients is with patients who have blood-borne cancers like lymphoma and leukemia. So we return to the outline again, and I want to next spend a couple minutes talking about treatment breakthroughs. So this is probably the most important slide in the entire presentation. It's that the COVID-19 is here and it works. It's been here for a long time now. So hopefully every one of us in this room who is at least 5 and older has been vaccinated. COVID, the vaccine reduces the risk of infection, and more importantly, it reduces the risk of severe disease and death. So if you have not been vaccinated, I can't emphasize enough, please get vaccinated. There have been other COVID-19 treatments that have come through. I think the most exciting one is Paxlovid or Nirmatrelvir-Ritonavir, which has been shown to reduce the risk of progression for people who have COVID to severe disease and death by 89%, though the availability of this drug is still quite limited. There are additional medications, including steroid medications like dexamethasone, remdesivir, and monoclonal antibodies, but they're mostly limited to patients in the hospital or with very high-risk features. And so we'll return back to the outline and then spend a couple minutes talking about endemic COVID and a look to the future. So what does it mean for something to be endemic? It means it's regularly found among particular people or in a certain area. So as opposed to pandemic, which is an abnormal surge and then it goes away, endemic means that something is here to stay. It's not going to go away. So what does this mean for us? It means that we have to learn to live with COVID and not wait for it to go away. So if you have not had COVID, you are likely to get it at some time. And if you are vaccinated, it is unlikely to cause severe disease and death. So once again, vaccine is the most important thing you can do to protect yourself from COVID-19. And if we go to the next slide, this is a provocative figure from the Financial Times. It's depicting England, but I think a similar trend would be seen in the US. And it has shown that COVID has gradually become less lethal through the pandemic than seasonal flu. And what does this mean is that initially, COVID death rates were 10, 20 times higher than flu. And now because of immunity, because people have gotten the infection, and because of vaccines, and because Omicron also is less severe, this has all led to the infection mortality rate, or the IFR, being less than seasonal influenza. So less people are dying when they get COVID than when people get flu. And so once again, this is something that is going to be something we live with. It's going to be like the common cold. It's not going away, but it's also not something we have to still be afraid of. So this is the next slide is the most provocative slide. It's a question: will we have to wear masks forever? So the first question is, how effective are masks? And this, early in the pandemic, if you were following things like I was, there was these videos online of people sneezing into a mask and showing how much less the particles spread. There was all this compelling reasons why masks should work. But then later in 2020, we had an initial clinical trial from Europe, which I don't mention, that actually didn't show any difference in infection between those who wore masks and who did not wear masks. So there's always been a question of whether masks work. I know in the US it's become quite a political question. We got the strongest evidence that they work from actually our own brothers and sisters in the South Asia, in Bangladesh, who did the most scientifically rigorous trial to date about masks in the whole wide world. And that study, they randomized patients in different villages to either have cloth masks or surgical masks or no masks at all, and compared how many people got COVID in those different villages. And what we saw is that people who wore surgical masks, those masks you wear in the hospital, they actually reduced the risk of infection from about 8% in the population to 7%. So about 10-11% decrease in the infection rate. But cloth masks, while it was numerically lower, it was not statistically significantly lower. So it did not suggest that they necessarily worked that effectively. But I guess the other question, actually, if you pop to the figure as well, this is another provocative figure looking at COVID cases over the last few months in the era of Omicron. And the orange line is in counties that have no public mask mandates, and the blue line is in counties that have public mask mandates. And you'll see that there's no difference in the cases between the two counties. So again, it sort of reinforces that masks may not be that effective at controlling the spread of COVID-19. And I would also contend to you, if we're thinking this is endemic, this is not going away, we don't wear masks to protect ourselves from the colds that we can get every season, you know? And if we are protected with the vaccine from severe disease, do we even need masks? Now, I will qualify this with one statement. I have also lost friends, colleagues, as well as patients of mine who were vaccinated but were immunocompromised. So there are patients who the vaccine does not work for. And so it's a personal decision that we have to respect when people are wearing a mask, either for themselves or to protect friends and family members, and that's okay. But we also have to respect people when they don't want to wear masks, provided that the laws are also allowing us to do so, like they are right now. I'd much rather see my brothers and sisters' faces here in the masjid when I'm allowed to do so than not being able to do so. And then in the last minute here, I have some closing reflections, just trying to bring this back to our faith. If you go to the next slide. So to me, you know, COVID-19 is a blessing. It's a reminder from Allah. So what do I mean by that? So if we go to the first bullet point, it reminds us of the power of Allah. This microscopic virus, this organism that is so small it needs another organism to live in, another living being to live in, has toppled our entire civilization. It has completely made us look like fools. That's the power of Allah, subhanAllah. It also reminds us of Qiyamah. What do I mean by that? In Surah Qariyah, it says, it is the day, the Qiyamah, being people will be like scattered moths. And I don't know if you remember at the beginning of the pandemic, if you went to Costco or Walgreens, you'd see these people chasing after the toilet paper, chasing after the hand sanitizer. And I came home and I told my parents and I told my wife, I said, this is what Allah is talking about on the Qiyamah. You know, that's what I felt like. You know, and even same thing with the vaccines. People were ready to cut in line to get a vaccine before it was their turn to do so, whether it's in this country or this country compared to other countries. You know, that's how we will behave, I'm sure, on the Qiyamah, and we're also doing so in the dunya. But, you know, in the dunya, we have responsibility to our brothers and sisters in humanity. We're not there on the Qiyamah. So if we go to the last bullet point, I think the biggest reminder, or the last reminder is, it's a reminder to treat our brothers and sisters with kindness. And that's our brothers and sisters in faith and our brothers and sisters in humanity. We should remember the prophetic tradition of the prophet who would go and visit the people who would abuse him to make sure that they were well when they weren't there to abuse him. Now, in the era of social distancing, you may not want to visit someone who's got COVID, but it still means that we should be looking after each other and treating each other with respect and not the behavior that, you know, we have been seeing among our leaders and among people in society every day. And so I come back to that last point of what I made on the last slide, where I think that we have to be able to respect each other for individual decisions, you know, in the same way that some of us will choose to eat a salad for iftar and others will eat a samosa, right? And we know one's better for you than the other. We have to also respect people with whatever decisions they make regarding COVID and not shout at each other about being vax or anti-vax or mask or anti-mask. We have to be able to live together as a society. That's what endemic COVID is, and inshallah, that's what we will strive to in the future. So with that, I thank you all, and thank you again for inviting me today.
Thank you, Brother Ali Raza, for such a wonderful talk. You know, we benefited a lot. Thank you, Dr. Kazim, also. Now we will have a panel of doctors sitting here to answer questions. Dr. Hassan, Dr. Assad, sorry, Dr. Ali Raza and Kazim, please. Are there any sisters, physician sisters? Farah Qasim Ali, are you here? If there are any sisters who are physicians in the audience, please come forward. Have a seat. You know, I did not introduce you guys properly, so I will ask you to introduce yourselves once again. Please introduce yourself.
Assalamu alaikum. Asad Hassoun. I'm an oncological surgeon and organ transplant surgeon at CPMC in San Francisco.
Assalamu alaikum. I just spoke, but I'm Ali Kaki. I'm an oncologist, medical oncologist, treating genitourinary cancers, cancer of prostate, bladder, kidneys, and testicles at Stanford University.
My name is Kazim Narson. I'm a neurointerventional radiologist at UCSF, and I treat stroke.
Assalamu alaikum. My name is Farah Qasim Ali. I'm a fellow currently in gastroenterology at CPMC.
Don't ask all at once.
I will make a couple of comments to start.
Mustafa, can we give him a mic? Start your question again.
Okay, I'll start the question again. Alhamdulillah, we've been able to stay safe largely. I'm sure some folks have actually been impacted by it. What do we know about the so-called long COVID so far and its effects on things like some of you are oncologists, cancer, fertility issues, things like that. And then second, is there any way to know even sort of a year down the line that you ever actually did have COVID? Is there such a test for those of us who never got tested and may have gotten sick? So those are the two questions that I had.
Who will take the question?
I guess I'm the de facto COVID expert. So I think long COVID is very challenging because the reality is that research has been, the quality of research generally is pretty poor. I think that there definitely are people who do have long COVID. They have significant symptoms. I think that there's been a lot of differences. For one thing, after any sort of viral infection, there are people who have a cold and can have symptoms that persist for 2 or 4 or 6 weeks. And some of the studies that call long COVID say anything after 4 weeks is long COVID. And so I think that there's overestimates of what long COVID is. I think that if we look at the history of coronavirus infections, it's unusual to have sort of a large number of people who have very persistent symptoms for a very, very long time. This is a different, virus than from previous coronaviruses. So I believe that there are some people who have this, but I think it's pretty rare for that to be the case. Things like fertility, I think it'd be very unusual. I know I've seen things across the board. Fertility, I've seen things about even causing cancer and any number of things. There are viruses that do those things. It's just not typically a respiratory virus like coronavirus. It's usually a virus that's going to integrate into your DNA, which this is not doing, not that we know of at the molecular level. So I don't think that that's probably happening for most patients. And then your second question was, how would we ever know? There were these serologic tests to look for antibodies that I think had more popularity in 2020 than they have now in some ways. I think we know antibodies wane over time. So I don't know. It's not something I'm routinely checking on any of my patients. And I don't know sort of what the quality of that assay would be sort of months or years after a possible infection. But I don't know if others feel it.
If you've had COVID in the past, do you still need to get vaccinated?
You're just picking on me now. Well, Novak Djokovic didn't think he needed to. I mean, to me, I think that you should think of the vaccine. Well, if you've never been vaccinated, you should get vaccinated. I think that like there's still we don't have enough knowledge of how well your immunity is if you've never been vaccinated. I think whether you've had your first 2 vaccines and had COVID, whether you need to be boosted every 4 months or whatever, I don't know if that's true. But I don't know if that's true for any of us. I think that we need to be a bit more nuanced in how we think about how we need to use boosters. I think that us as physicians will probably be getting them for a long time. But if you're not exposed to people who are high risk, I'm not sure if you need to continue to get boosters. But we'll see how the evidence and thoughts about that continue to evolve.
The question is, what's the incidence of reinfection? Do anybody knows?
I don't think we have good data on that. I mean, I think that
If you've been vaccinated?
I think that there's anecdotes of that happening.
How
But,
about if you got infected but not vaccinated?
yeah, I mean, I think there's people who have had it 2 or 3 times. But there's also this sense that these not good data, but that you have the severity of symptoms are less every time you get it, which would make sense biologically. But.
Vaccine, everyone should be vaccinated. We as a physician, I personally got infected and got 3 vaccines, and I think we're going to get the 4th one too. So vaccine, that's the biggest advice. I could tell you the impact on COVID-19 on surgical care. For almost a year, surgical services has been declined, almost 100% to all elective cases, only emergency cases. Patients that come to the hospital with positive COVID tests would be sent home. Speaking of the 40% that's asymptomatic. And then as an organ transplant surgeon, any donor that has COVID positive tests would not, their organs would not be accepted. So that had resulted in a significant decline in transplant in emergency cases. And recently, we start accepting donors who are COVID positive. They're asymptomatic, but COVID positive, provided that recipient is vaccinated and has enough antibody. So that's the current practice. The other thing that the mask, at the hospital we are still required to wear a mask. And I could tell you one benefit from the mask is that the incidence of flu has declined significantly, right? You've noticed that.
And I will say that there is stronger evidence for wearing masks in the hospital than there is in the community. And so like the Bangladesh study that I was talking about is a community-based study. I think there's multiple studies that have been done 10 to 15 years ago with other pandemics that have shown the benefit of masks in the hospital for physicians to avoid getting and spreading to their patients. So.
As a side note, it gives me immense pleasure to announce that Dr. Farha Qasim Ali grew up in this community. She's the daughter of Samana Tajri and brother Ghulam, and she's the niece of Mustafa Tajri. So she grew up in this community, and now she is doing a fellowship in gastroenterology. Do you want to say something about your specialty and COVID?
I guess COVID is the theme. So for me, the kind of things that I deal with specifically when it comes to COVID, it's usually when patients come in bleeding. So if they've had blood in their stool or if they're vomiting blood. So the impact of COVID comes in where we have to figure out if it's something that's unrelated to COVID or if it's worsened from COVID. So for us, we see what we've had to decide over the last few years is how emergent are the cases. Can this be something that can be kind of pushed back because of the active infection? And at that time, there was no vaccines and things of that sort. So we learned a lot in terms of what COVID causes for the GI tract, and that could be increased bleeding, even clotting sometimes. Sometimes you see, or we would get called if some of their liver tests were elevated. So if the liver was injured, other things, just GI upset, nausea, vomiting, and these things can linger. So even after you've supposedly healed from COVID, these symptoms can actually stay with you for weeks and months and even ongoing. So it is definitely something that's why you have to, take it, you can't take it lightly. You have to make sure. In the past, before vaccines, it was really important to make sure you don't get COVID, but now even with the vaccines, it can lower your symptoms. So those are the kind of things we deal with: the GI tract, upset stomach. It's hard to distinguish if it's from COVID that you may have had months ago versus is this something new. And so those are the things that we would kind of try to figure out if you were seen by a gastroenterologist.
Say, you have a group of specialists here that could run a whole hospital. So if you have any questions, seriously, anything in the GI, liver, kidney, pancreas, anything that comes to your mind, this is very, very rare group. So take advantage of this.
So I have a question. Obviously you mentioned before the COVID vaccine, going back to the COVID vaccine, what's the future of it? I mean, you mentioned there's gonna be more, there might be a fourth booster shot. Is it gonna become like a seasonal thing where it's gonna be like the new flu shot? Or are we gonna get to a point where it's gonna stop? What do you think the future for the vaccine is gonna be?
So I think a few things. I think that these Moderna and Pfizer are reportedly working on a new vaccine strain. All the boosters so far have been the same vaccine that you got the first time. And so hopefully by changing that, you might get better, more durable, so longer lasting response. Right now, it looks like in high-risk populations, the antibodies seem to wane after about 4 months. But I think really for people who are not at high risk, the question that we need to ask is, what's the benefit of keep getting a vaccine, right? Because we don't vaccinate against the common cold. And so I'm not sure if there's a continued benefit for low-risk people, for people in their teens, 20s, 30s, 40s, who don't have any of those high-risk features. I'm not sure if there's a benefit to continue to get a vaccine when we're not going to control and make this go away for forever. I think that there is clearly a benefit, especially if you're a blood-borne cancer person getting rituximab or some other severely immunocompromising medication, where you're not even going to hold onto your antibodies for very long at all. If you're a organ transplant person who's on many immunocompromised medications, there could be an ongoing benefit to continued doses. If you're a physician who is treating these people and you don't want to even have an asymptomatic infection that you don't know about because you could spread it to someone, there could be an ongoing benefit. But I think in terms of community spread, I think we have to ask those hard questions and make sure we don't just accept being vaccinated for forever. That's my thoughts.
We talk about what's the future for COVID-19 in general. And this is a topic that's being addressed almost on every day at any hospital. And the truth is that if you want to eradicate COVID-19 or coronavirus of that nature, you have to vaccinate the entire planet, which is not possible because of greed, because of hypocrisy, because of vaccine availability, because of poor knowledge, because of stubbornness. Even in this country, there's so many people are stubborn and not willing to take the vaccine. So if you have a plan where the entire world population get vaccinated, that's the only chance where you could get rid of this. On the other hand, this is becoming gradually like a flu-like illness, and you're going to have to live with it. But is there any way you could eradicate this, like smallpox, or this is not going to happen?
Assalamu alaikum. Can you comment on the fact that a lot of doctors believe if you get a good amount of vitamin D in your systems, you fortify your defense systems and it really resist getting the corona? And also there's doctors that they believe that they have patients that they brought their level of vitamin D is up to 30, 40%, 50%, and they didn't catch the corona, or at least they didn't, none of them died. Also the fact that right now people are have both of the vaccines that they have one booster or two boosters, still they get in the corona and get sick.
There's no studies that have proven that high vitamin D levels can reduce the risk of COVID. Vitamin D has been something that has been tested for a lot of diseases, heart disease, cancer, and almost across the board, those studies have all been negative. I think that we know vitamin D has an important role in bone development, in calcium metabolism, how your body handles calcium. There's a lot of theories of how vitamin D can be helpful otherwise, but in general, those have not been proven. And that includes COVID.
Yeah, I just echo what Dr. Kaki said, that I don't know of any study that demonstrates that vitamin D levels protect you from infection. My impression is that our vitamin D levels are in general lower now than they were 50 years ago because we're spending less time in the sun. And because of that, a lot of things are attributed to low vitamin D levels that may or may not be related.
Salam alaikum. Thought Qabul. My question is about from oncologists. Have you heard any getting, for instance, after COVID positive cases increase the risk of lymphoma or blood cancer? Of course, assuming having some susceptibility risk factor to get cancer, but in a healthy person, have you heard COVID increase risk of cancer in any how? Because I had some friends in medical intern, I'm a foreign medical graduate too, and they got lymphoma and unfortunately died after COVID.
Yeah, I mean, there are those studies out there that suggest that, but I don't believe that. There's not been well done, rigorous studies. I think it'd be very unusual. Most of the time, lymphoma can be caused from a number of viruses. They're all herpes viruses. I was actually talking to a colleague about this today, and what's different about herpes viruses is that they really integrate into your DNA, and they also have a history. The entire family of herpes viruses have a history of staying in your system for decades. Your chickenpox you got as a child can cause zoster, shingles, decades later. No coronavirus in history has ever stayed in your system like that. And so why do we think that this is so unique? And why do we think that this can all of a sudden cause cancer? It'd be very unusual, and the studies to date don't stand up to that. So. Yeah, exactly. And it could also be that because they were in the healthcare system, they found that, there's a lot of that can happen.
Sister, are you a physician? Yeah, I could tell from your question. You should be on the panel.
Come join us.
Now, we have some selective cases of specific severe cardiomyopathies from COVID. There is a lot of GI symptoms and diseases happen from COVID-19, but that's not the most common presentation. There's also a lot of talk about CNS long-term impact from COVID-19. But if you talk about oncological impact, you need number and you need time. We're only living within 2 years and probably need more than that to find out.
I think it's important to acknowledge that COVID, when it's severe, it's a systemic disease, so it affects multiple organ systems, including your blood system, the brain, your lungs, the heart. And so when it's severe like that, it's affecting the entire body. There was an increased incidence of stroke in New York when the COVID pandemic was at its height there. And later on, it seemed to just be related to an increased propensity to form clots everywhere in the arteries and also in the veins. Many of the long COVID symptoms have also been attributed to this propensity to form clots in the blood vessels in the neck or the blood vessels in the legs, causing these long-term symptoms. So, the infection can cause myriad kind of effects on lots of different organ systems, particularly when it's severe. And the best solution is to not get it in the first place, or if you do get it, make sure it's a mild case by getting vaccinated.
I have a question for you about the cardiomyopathy. Sure. In the 18 to 40-year-old population, the cardiomyopathy has been seen as maybe as frequently with vaccine as 1 in 5,000. Is that something you worry about?
There's different vaccines, and one of them is which one is
Moderna and Pfizer.
Moderna is like, it was 1%, 1 to 2%. And compared to the number that was used at the end, it means nothing. So the chances of you getting cardiomyopathy from just flu illness by itself was calculated to be higher than what happened with the Moderna vaccine. So from the analysis we got is that this was exaggerated, and countries and people start shying away from it. The one thing that still, a big puzzle is that why some people get this extensive kind of microangiopathy in the pulmonary circulation and others don't. Even in young people without underlying diseases, they succumb to this virus because of severe embolization and microangiopathy that happened in their pulmonary system. So that's not known yet, why selectively some cases has been affected this way.
Say that you already took all the vaccines. Is there a chance that later in the future you can develop negative effects?
Yes.
All treatments are going to have some small chance of a negative effect, and so there isn't a vaccine that has a 0% chance of having any sort of side effect. So all vaccines are going to have some chance of a side effect, but it's such a small chance of a side effect, and the benefit is so much greater if you're able to avoid a severe case of COVID, that it's justified.
Since he's talking about that, there's two things that everyone should know. One, this virus, we all, human beings, are DNA, our genomics is DNA predominantly. RNA is being used as a transporter, communicating between the cells. This virus is an RNA virus, and any RNA virus is more detrimental to us. The other thing, this vaccine, like Pfizer and Moderna, they are RNA vaccine. This is the first thing ever to be generated. That's what there's so much concern, is that typically vaccine is either a dead virus or a shell, like a skin of the virus. They use it, they take the protein and they make a lot of it and they inject it to create the antibodies. But this is different. The technology that was used to get the COVID-19 vaccine is the first ever, and that raised a lot of problems. And whether you're going to have a problem in the future, you read in the online a lot of these stories about people will die in 20 years and people will not be able to conceive. So all of this is just like media talk. But the truth is that so far it's been relatively safe. But is it possible that could have an impact in the future? Possible. We don't know.
These are, is this fair to say, these are some of the safest vaccines that have ever been developed in the history of humanity. Like, it's like a feat of science that these vaccines have been developed as quickly as they have, and they've been as effective as they have. And, the side effect rate is really, really small. Yeah, and the people who we should really be lionizing for making all this possible are Turkish immigrants in Germany who developed this technology, and we should hold them up as role models for really making it possible for us to return back to a somewhat normal life.
So final question, who should wear a mask at Saba? Seriously, who should truly wear a mask?
So this is So if your mother or uncle, you wear a mask because, should I tell them? He's got secrets why he wears masks. So I think that, first of all, if the laws say you should wear masks, we should follow the law, because, as good citizens, we should follow our local laws. At times where the cases are low and we think, and the government, our public health figures have deemed it safe to not wear masks, I think that if you feel comfortable wearing a mask, you should wear a mask, first and foremost. I think that if you have risk factors where you don't feel you're adequately protected with the vaccine that you have received, you should wear a mask. I think that especially if you have, your doctor has told you you should wear a mask, you should wear a mask. And then if you have a family, if you yourself don't have any of those risk factors, but your family members do, and you're worried about them, then you should also wear a mask. Because if you bring COVID home and you're living with them, then that would also be a bad thing. But I think that at times right now when there's very low cases, the public health officials have considered it to be safe, I think we should also feel comfortable not to wear masks.
So if there are no more questions, then we will conclude tonight's program. Is there anyone who has any questions? So I would like to thank the doctors on the panel here. I mean, we are getting very fortunate now that we are getting all these highly accomplished doctors in our community. We did not have many physicians coming to the Bay Area because of the high prices, but I see now all these youngsters are moving into the Bay Area, with high credentials. They're working at big universities, UCSF, Stanford. So I think we should all be very proud of our physicians in the community. I only wish the community takes advantage of this. I wish we had more programs. Each year we have programs, one program during Ramadan, but the attendance is really not as good as it should be. So please tell all your friends, all your relatives to come and attend these programs. So it's an encouragement to us and it's an encouragement to you too, and you can learn a lot from this. And then health is so important for all of us. If you have health, you have everything. You can do better ibadah with health. So with this, we will conclude the program. Thank you very much, all of you. Dr. Farah, Dr. Kazim, Dr. Ali Raza, and Dr. Hassoon. Did I pronounce it right? Thank you. Let's finish the program with Dua Imam Zamana. Please, everybody stand up. Ashwaq, come here. Bismillah ar-Rahman ar-Rahim. You want to talk one-on-one? Yeah, we are.